Hi everyone, welcome back to the channel. Welcome to the Revenue Cycle Pro. My name is Fatima and I am your revenue cycle expert. And today we're going to talk about a portion of the revenue cycle, a payer that is often forgotten and or not pursued as much, and that is self-pay, patient responsibility. During the revenue cycle, often or not, depending on how you're driving your practice, often self-pay or the patient's responsibility can be forgotten. It isn't necessarily always treated like a third-party payer, such as a commercial carrier, Medicare or Medicaid. And it's kind of tricky, right? Because any kind of conversation you're having with an individual that owes you money can obviously be a tense conversation and an uncomfortable one for all parties involved. So I am going to give you some of my best practices, and hopefully some of my suggestions will help mitigate and close some of those loopholes in regards to collecting our self-pay patient responsibility cost share balances. First things first is before you even see a patient and provide services, you want to notify them of what the expected cost share is going to be for the patient. This is typically done by verifying the benefits before even scheduling an appointment. So that way, when you call the payer, you can let the payer know what the expected services are that are going to be rendered, and the payer can tell you about any pertinent deductibles, cost shares, co-insurances, etc. So that way that information can be communicated to the patient before they're even seen. And there's a clear expectation on their end that payment is due at the time of service. Best practice is to always have a written documented financial policy that you would typically get a signature for during admissions when a patient is filling out their admissions packet. And also being able to have this information to be signed online as well, right? We have technology and there is the opportunity for some of these documents and communications to be done via online and a patient to actually sign off on and agreeing to their copay and or cost share. So you always want to make sure that you're discussing patient responsibility prior to an appointment being made. And then also you want to make sure that the patient has the understanding, unless otherwise other arrangements have been made, that the payment is going to be due at the time of service. Another way that you can optimize your cash collections for your patient responsibility is, of course, you want to offer all ways to pay. Having multiple ways for a patient to pay their patient responsibility is going to ease a lot of your cash collections. You want to take advantage of online payments. You want to take advantage of e-checks. You want to take advantage of pay by phone. And you also want to take advantage of all the various mobile cash applications, such as Venmo, PayPal, Cash App, etc. You want to have the ability, Apple Pay, you want to have Google Pay, you want to have the ability to accept any form of payment, because it is going to be much easier for you to collect payments up front rather than trying to collect them weeks, months, or even a year down the line. So you always want to make sure that you're offering to accept payment in almost any way, shape, or form. And with all of today's technology, using the mobile apps is definitely one way to do so. Internally, another step and tip you want to take is to make sure you have a documented self-pay SOP. You want to have a standard operating procedure documented for specifically patient responsibility, because it is handled a bit different than it is when you're seeking revenue and cash collections from a third-party entity. So having this documented, the process of it on file for all folks within your agency or your practice to have, such as your front end folks. You want to also make sure your finance and billing team is aware and has this document on file, so everyone's following all the protocols and procedures from beginning to end to ensure that you're collecting that patient responsibility, aka patient revenue. You also want to ensure that you're treating this just like you would treat any other payer. You should be running weekly billing reports. You should be looking at your days outstanding in AR. You should be making every attempt, right, to collect any past due balances. And often, sometimes creating financial agreements or payment plans are going to be your best option. So you also want to make sure that you have the ability to put credit cards on file or put AHC transactions on file. So that way, if you are making payment arrangements, you're not necessarily dependent upon the patient to call your office, go online, and make a payment. You can create a scheduled monthly payment with an automatic payment source. Having that on file will make the cash collections for self-pay, patient responsibility a lot easier. Once again, you want to monitor self-pay just like you would any commercial payer, any Medicaid and or Medicare payer. You do not want to treat it differently. Hence, you will be leaving money on the table. And also, if you are a participating provider and you have a contract with these payers, it is your duty and your contractual duty to collect those copays. Keep in mind that the patient cost share is also a part of your negotiated fee schedule. So it behooves you to collect the patient responsibility. Otherwise, you are being underpaid for your claims. You also want to make sure that your front end staff feels empowered to discuss client balances with patients. Once again, anytime you're discussing money, anytime you're talking about this sensitive topic, emotions can arise. Feelings can come up. There can be a bit of uncomfortableness. However, if you've provided your front desk staff with all the tools and resources, such as the ability to take all types of payments, this is going to ease a little bit of that discomfort and or uncomfortableness, and it will give your front end staff the empowerment that they need because they are the front line of first line of defense. Immediately when a patient walks into your office or practice, they're going to be greeted by the front desk folks. And those are the folks who are really going to be the ones to collect the copays at the time of service. So making sure that your staff is trained, that they have good etiquette, and that they feel empowered to discuss patient responsibility when patients come for an appointment, that is crucial because they are the folks collecting that money up front during that first visit. Another thing that providers need to do is come up with a plan of realistic collections. No one likes to hear the term write-off, but I'll be very honest with you. Once a fish is dead in the water, it's dead in the water. There has to be a point in the revenue cycle for your self-pay balances where you're going to say, it's actually costing us more to mail these statements than it is actually the amount that we're collecting from mailing those statements. I see it all the time. Providers are mailing out statements. The postage is costing $200 or $300 a month, and they may be lucky if they get $100 worth of payments. So there is a time when you need to review your AR and accept your losses and write off balances that are unrealistic, right? By doing that, that allows your billing staff, your finance team, your front end staff to focus on those truly collectible receivables, preferably things that are more current. It is going to be extremely hard to get a patient to pay a bill from a year, 2 years ago, right? So once again, knowing when to cut the bleeding and to say this is a loss so that we can focus on the items that are actually collectible. So quick rundown. This is what we should do to ensure that we have a successful self-pay revenue cycle. Our patient responsibility is getting collected. One, we need to be upfront with the patient, let them know what their expected cost share is, communicate that to them, and have them sign a financial responsibility form so that way there's no communication in regards to what the expected payment is and the terms of those payments. 2, make sure that you're accepting payments from all platforms. You want to join all of our mobile apps. You want to make sure you're doing e-checks, taking patient payments by phone. Whatever means you need to use to get those dollars in the door, by all means, you should be ready to accept all payment sources from your patients to optimize your cash collections. 3, you're going to want to treat self-pay just like any other third-party payer. You're going to want to stay on top of your AR. You're going to want to run weekly reports. You're going to want to track payment plans to make sure that patients are keeping up with any payment plans that you've implemented. You want to make sure that you have patients' banking and or card information on file with their permission, of course, so that way you're looking at automatic payments. You're not chasing a patient to get, their permission to charge their card, or you're not waiting for a patient to call in or go onto the portal and make a payment. The payments are going to be automatic. That is definitely going to optimize your cash flow and making collecting this money is a lot easier. Number 4, you're going to want to make sure that your staff feels empowered to talk about these have these tough conversations with patients. Even if it's one dedicated individual and not necessarily the whole front end team, identify somebody on your team who's really good at talking to patients, really good at communicating effectively. Once again, you want your front end staff to feel empowered, right, to ensure that they're collecting those copays from patients. And then 5, we want to make sure, 6, we want to make sure that we're cutting our losses when we need to. When we're circling back and focusing on AR that's 2, 3, 4 years old, the likelihood of collecting that monies is going to be slim to none. So when you come up with a plan and devise a plan and you're able to sit down and think about, hey, when do we say enough is enough? You want to implement that so that way your staff, your billing team, your finance team can focus on those current receivables. So I hope that this was helpful, and I hope that it explained some of the best practices for collecting self-pay revenue in the revenue cycle. Once again, self-pay patient responsibility is often forgotten, money left on the table, but by instilling and implementing a couple of these things that I talked about today, this will ensure, 1, you're optimizing your self-pay collections. 2, it's way more efficient to go as automated as possible and accept as many payment ways to pay as possible. And 3, to know when to let go, right? You got to know when to let go so you can focus on what is actually collectible. So I hope that you take some of my tips and implement them into your practice, your SOPs, your processes for cash collections in 2024. We don't want to leave any money on the table if we can help it. Implementing a few of these or all of these is definitely going to optimize your cash flow and your cash collections for patient responsibility. So once again, if you like this video and you like the content that I'm discussing here at the Revenue Cycle Pro, please like, comment, and subscribe. And I look forward to discussing with you in my next video more things that affect our revenue cycle from the patient, provider, and payer point of view. Thank you for watching. Please subscribe, share this video, and I will see you in the next one.